Here at MedStar, we provide high-quality cancer care by precision oncology as well as evidence-based approach. We have a team of providers who are excellent at what they do. They care for their patients, they come up with the treatment plans accordingly, and they also make sure the patient is well informed. And the best thing is it's closer to their homes. And we provide the same amount of care for every person who walks in through that door. I'm a community-based medical oncologist as well as hematologist, so I see a lot of hematologic malignancies as well as solid cancers. I have a particular niche for breast and ovarian cancer. In regards to hematologic malignancies, I treat lymphomas and multiple myelomas. Community oncologists are the physicians who deliver high-quality cancer care for patients closer to their homes. The sense of community plays a very important role in oncologic care, so that patients feel less isolated, they develop more emotional bonding with the physician and their care team. And I believe that's a key in managing these oncologic patients. So medical oncology is one of the constantly changing fields out there in the Department of Medicine. We have a lot of clinical trials and research that led to this path. A few years ago, the standard of care was only chemotherapy, but now we hear all about immunotherapy, targeted agents, CAR-Ts, etc. And there are more coming. So here at MedStar, we conduct weekly multidisciplinary conferences where medical oncologists, radiation oncologists, along with our surgical colleagues are present. We go over all the imaging, the tissue diagnosis, and what are the available options on the table, which can include surgery, radiation, or in some cases, it can only be medical oncology's involvement with chemotherapy or other therapies. By doing so, we make sure all the providers are on the same page. And by doing so, it gives a sense of confidence for the patients that all the providers who are involved know the plan. So that's what we do it differently when compared to other institutes out there. I believe trust plays a big role in good patient-physician relationship. And I achieve that by talking to the patient as well as their families. I know confounding cancer diagnosis could be difficult on these patients as well as their families. So we involve a lot of discussions. I meet them multiple times so that they understand the plan, so they know that I'm equally responsible in treating their conditions. I lost one of my family members to ovarian cancer, and I have seen my family go through this emotional journey and overwhelming journey. But one thing that comforted them was the physician that was taking care of them, and that's what inspired me to become an oncologist today. I love to see the happiness on my patients' face when I tell them, you're cured of cancer, and I'm honored and blessed to be in this role to help them and care them every day. That's what brings me in. I always believe a cure is on the horizon, and one day it's definitely going to come.